You touch someone, you shock them, like electrical shock. You touch a metal surface like the doorknob or anything metallic in the house, you get shocked yourself. Now, this might be some of the major symptoms, but sometimes you might have numbness and tingling sensation, especially in your feet and sometimes in your hands. You have issues when it comes to remembering something or even speaking, and that feeling of depression, or sometimes you get those mood swings that usually come and go. This is highly confused from iron deficiency, but it's not. This is a classical symptom of vitamin B12 deficiency. Now, your body cannot be able to make vitamin B12, so you have to get that in food, or if you're not getting that in food, you'll have to take supplements to compensate for this. What usually happens is you eat food that contains vitamin B12, it gets to your stomach and meets HCl, hydrochloric acid. Very important. It helps in extraction of this B12 vitamin from the food, and then there is a factor, it's a protein that we call extracing factor that will help in transporting that vitamin B12 from the stomach into the blood now across the walls. Vitamin B12 is very important when it comes to so many processes in the body, but one major one is the making of the red blood cells. It's very important, and that's why there's a relationship between iron and vitamin B12 in such they both can cause anemia. Now let's go to the causes. This deficiency is higher in females than in men for the obvious reasons. There's a higher demand for this vitamin in ladies because they usually lose their blood every month. This is to compensate for the red blood cells they usually lose. So they need to make more, and this is where now the demand for vitamin B12 goes high, and they mostly deplete what they have, so they need to increase the intake. Now, we have several things that usually cause this condition, and one is malabsorption from the gut. When you have an issue such that you cannot be able to absorb as much of this vitamin B12 in the stomach as possible, you're going to have a deficiency in this. Remember, we said you cannot manufacture this in your body. You'll have to gain this through diet or maybe other means. Now, you have gastritis, which is the inflammation of your stomach. Now, this will definitely cause your stomach not to absorb or to function as it's required. And sometimes when you have retro or less of the HCl, this is the acid in your stomach, you are likely not going to get this vitamin B12. And this is why those people usually take antacids for a really long period of time. They are likely to suffer from vitamin B12 deficiency because they are affecting the concentration of HCl in their stomach. Another cause is diet. When you are not taking vitamin B12 enough of it in food, you are definitely going to have a deficiency in this, and this mostly affect the vegans. Those who usually don't take animal products, which are very rich in vitamin B12, they're most likely going to suffer from vitamin B12 deficiency unless they take that in supplements. Let's go to diagnosis. You go to that hospital, there is a test, a laboratory test for vitamin B12, and if you have a figure which is less than 150 per ml, it means you have this deficiency. Also, for us to check the quality of the red blood cells that you have, there is a test that we call full hemogram. In case you want to know more about this, go to my YouTube channel. I have a really long detailed video about CBC and FHG, which is full hemogram and complete blood count. We can get the characteristics of the red blood cells, and we can be able to tell whether you have the issues with the vitamin B12 based on how the red blood cells appear. For the treatment, fix the malabsorption. Anything that's causing you to not absorb as much of that in the food, fix that in your stomach. If you're taking antacids, which are maybe contributing to you not having enough acids in your stomach, maybe you can stop that, or maybe talk to your doctor and see how you can be able to navigate around that. For the vegan, you'll have to decide whether you're going to be taking that in supplements, or maybe you're going to give up and start taking animal products because they contain a lot of vitamin B12. Now, we have foods which are very rich in vitamin B12, and they are animal products. We have red meat, we have fish, we have eggs, we have milk and milk products. When it comes to milk and its products, you'll have to be lactose tolerant. For those who usually have issues with lactose, you'll have to avoid this and take the other things, like for example, the red meat. Always aim at 2.4 microgram per day for the adults. Every day. Always make sure you just have that. And also, in case everything is not working out for you, you might have to take vitamin B12 either orally, those are the supplements. Also, we have nasal sprays, and also even have nasal gels that you just put in your nose, and then that vitamin will just go directly to your blood, and it will supplement or compensate for the lack of this vitamin. Also, we have IM. This is intramuscular injections. You get that injection that will give your blood this vitamin B12 that will be available for now the processes which it's required for. I hope you are now educated. Let's meet in the next video.